Alright guys, for those of you who do not know, for the last 7+ years I have been a substance abuse nurse. Been in substance abuse most of my nursing career. There's not anything I've done longer in nursing than substance abuse. That being said, someone asked me to talk about it, so I decided let's go ahead and make a video about it. So let's go with the very beginning. How do you become a substance abuse nurse? At my particular facility, not every facility, and I have seen new grads become substance abuse nurses, they request a 1-year previous experience in some sort of nursing. Like I said, I have, especially here recently, seen new grads become substance abuse, but typically they want you to do 1-year nursing experience, and that is not due to the complexity of necessarily the job or the complexity of the skills that you'll use, but more or less the math and the dosage calculations that you will be using throughout your job as a substance abuse nurse. No two people are the same, and that's no more different than in substance abuse. Typically day to day, I very rarely see the same med or the same dosage used for any two particular patients. Typically, I might see the same dosage of the same medication used 2 to 3 times throughout an entire day. Everyone's different. Everyone is different in every aspect. Mainly, the staff that I deal with is not nursing or even medical, but a lot of counselor-based staff. Most of the staff that I deal with are counselors. I do have a provider that I deal with. I do have multiple providers that I deal with, and by deal with, I don't mean like in a violent way. I mean like speak to throughout the day. Typically, I am dealing with counselors, caseworkers, things like that. Very rarely am I dealing with other nurses. You know, we are of course a nursing team, but most of the time I am dealing with counselors and explaining why meds may or may not work, or explaining why the dosage that's being requested is not correct for the medication, things like that. Most of what I deal with is counselor-based staff. So the nursing staff is actually the smallest staff in my facility. Counselors make up the majority of my staff. Now, some facilities have what's called group. Group is based on counseling. Nurses, we really just give out the meds and do quick assessments and things like that. Labs, we at my facility are responsible for our own labs. We do not have a phlebotomy crew. We do not have a phlebotomist department. The nursing staff is responsible for all of the labs given, all of the shots, all of the IVs, all of the any sort of med that you can think of, or way to get it out, or way to test for it, is done via the nurses. So we also do a lot of urine drug screens. If there's a urine to be obtained, 99% chance that there's going to be a nurse obtaining it. Actually, to be quite honest, I don't know who else is going to obtain it. So we do the drug screens, we do the blood draws, we do all of those things in the nursing department, which again is the smallest department in my facility. Not necessarily every substance abuse facility, but in my facility it is all based on the nurses, which is the smallest department. Now, do we do the most work? No, I'm not arguing that at all. What I am arguing is that we are the smallest department and we are responsible for a lot. Some facilities are in-house. In-house basically is what it sounds like. The patients are confined, living in a particular quarters for a length of time. Some of these can be up to 90 days. Some of these can be as little as 3 days. Some of these can go even further than 90 days. It all depends on the facility that you're staying at. Not all facilities are the same. Not all patients are the same. Some patients get like 13 days and they are out on their own. Some get 90 days and then they go to like a halfway house sort of thing. Everybody's a little bit different. Now, why I took this job? I took this job particularly for the hours, not because of the type of job that it is. I know I've been there for 7 years, but I took this job specifically for the hours. Now, anywhere that you go, hospitals, nursing homes, typically do like a 7 to 7 or a 7 to 3 sort of style shift. In substance abuse, at least at my facility, we do 4 to noon, 4 a.m. to noon. So currently right now it's about 1 p.m. I'm out of work. I've been out of work. I've come home. I have time to do this before my children get home from school. This is why I took that job. I specifically took a substance abuse job for the hours. And typically, if you're in a substance abuse style setting, your hours are not the same as they are at a hospital or at a doctor's office or things like that. 4:30 to 12:30, 4 to noon every day is not bad at all. I thoroughly enjoy it and really, really, really love coming home every day and still having the rest of my afternoon off. It's wonderful. I love it. In any case, that's why I took the job. Pay, however, is not as good as anywhere else in nursing. I've never been anywhere else in nursing that made less, given the time frame. You know, of course, COVID sort of changed all of that. Even in substance abuse, COVID changed all of that, because a lot of your patients in substance abuse couldn't really go anywhere, like AA and things like that. Pay is less than most facilities. Pay is less than any hospital. Pay is less than most doctor's offices. But still, I'm not hurting. My family's not hungry. We are not in bad shape. If that's, you know, any indication as to, oh, I don't want to be a substance abuse nurse because y'all don't get paid. No, you know, we're still eating okay. You know, we're not hurting. My bills are still paid. That sort of thing. But I could make more at a hospital or at a long-term care facility. I just don't want to. I cannot give up those hours. Woo, those hours are phenomenal. You just got to get up early in the morning. Great times. Daily, I see a lot of patients. I may not see the same patients every day, and then again, I may see the same patients every day in a given week. It all sort of depends. It's, you know, you get to know patients in substance abuse, you get to know them well, you get to know them differently than in any other field that I've ever been in. I've never been in a field where I get to know the patients as I do in substance abuse. That is definitely, if you like getting to know your patients other than like home health, you really don't get to know your patients any better. And of course, that's one-on-one. In substance abuse, I'm however many on one. You get to know your patients very well. And if you want to know your patients very well, substance abuse may be for you. Some of your patients can be trying at times. Some of your patients can be wonderful at times. And you get to know them as well as any other field, probably better than any other field, especially if you just so happen to be sort of involved in their counseling process or their groups, things like that. It's the best place to get to know a lot of people. I will say that much. A lot of people have a lot of skills. So if you're ever having questions about someone doing your roof work and you ask a patient of yours that does roofing, they'll probably tell you, hey, they're doing it right or they're doing it wrong. Not to say you can hire your patients to do roofing. You cannot hire your patients to do your work. That's a no-no. That's a HIPAA violation. You can't do that. So I'm not saying that at all, but you know, you can ask your patients questions that they may or may not have expertise in, and may or may not be able to lead you to the right direction in. The best field I've ever worked in, the best hours I've ever had, not the best pay I've ever had. That was in dialysis by far, but definitely one that I have thoroughly enjoyed. I have thoroughly enjoyed learning the medications that are used. I've thoroughly enjoyed learning about why we're using these medications and, you know, reuptake inhibitors and things like that, and how it affects the body, and how certain mental crises help when you're in substance abuse, and the tools that are used. It is a great, great, great career. It's been great to me. It's been phenomenal to me, and I have thoroughly enjoyed it. If you are looking into substance abuse nursing, I highly recommend it. It's not for everyone. I will say that. It is not for everyone. But if you feel that you could do it, if you feel that you have the want to get into substance abuse, do it. Go for it. It's been very good to me. Very good to me. Hope it helps. Hope I answered the question. Thank you much.